My name is Dr. Nadumba, an orthopedic surgeon. And as orthopedic surgeons, we normally get these patients who have the condition we call osteoporosis. That's when the bone density decreases. Patients present with decreased bone density because of the imbalance in the minerals of the bone. They tend to have low calcium deposits in their bones, and therefore with the risk of fractures. This kind of problem, we see it more in the elderly patients. So you can call it senile osteoporosis or adult onset osteoporosis. So it is an aging disease or disorder. And these patients may present with pain in their bones, but the majority come when they have already developed fractures. So, the fracture can be in the hip joint, or it can be in the spine. But of course, the majority present with just bone pain. But in some people, it can be associated with diet. If one has malnutrition, eating a diet which is poor in calcium, you can get that risk of getting osteoporosis. In some, it is because of poor absorption of calcium in the intestine, especially those who have deficiency of vitamin D. But this one will sit more in the children, and those are the ones who have rickets. And then we can also have it in people who drink a lot of alcohol, or who are the smokers. So with smoking and drinking a lot of alcohol, the risk is very, very high for getting osteoporosis. So I've mentioned that these patients are normally elderly. They are more than, the majority above 70 years of age. And they present to us with bone pain. Of course, when they come, we normally do some investigations. We do clinical assessment. You can do x-rays, and then you can do the bone index studies of these patients. We also do some blood tests on them for the kidneys, for serum calcium, the phosphates, and also try to identify the causative for the osteoporosis. It can also be seen in patients who are senile, and those who are inactive patients. For example, if a patient is very sick and is always lying down in bed, being very, very inactive, the risk is also quite high in such patients. So that's what we call osteoporosis. But of course, there are several types. If I could go in the types, there's that one which we see in children. I've already mentioned the rickets as one of the conditions associated with osteoporosis. In children, you get children with deformed bones, the bones which we call wind-blown legs. The knees are all deformed, bones are very soft, the wrist joints tend to be very wide. And again, they present with deformities, leg deformities or limb deformities. Then in ladies after menopause, okay, that's what we call postmenopausal osteoporosis. Women, of course, after the age of 45, they tend to lose a lot of calcium because of the hormones. They tend to have decreased estrogen hormones, and as a result, they start losing their calcium. So they end up having what we call postmenopausal osteoporosis. So those are some of the factors which I can mention at this stage that can be postmenopausal, can be nutritional, can be lifestyle, especially those who drink a lot, and those who do a lot of smoking. And then can be age-related, and that is a senile, especially after the age of 70. So that is osteoporosis. We are happy to be talking about it, and definitely we want to build better bones according to the theme. And during this World Health Day on osteoporosis, I think people should really know about osteoporosis and take some precautions to make sure they try to avoid it. One, in the women above the age of 45, we encourage them to take supplements which contain calcium and vitamin D, and this should be taken on a daily basis as a way of preventing the osteoporosis. And then children who have deformed bones, because the mother may produce a child, and when sees the child, the bone is getting deformed, especially around the knees. One leg is facing this direction, another is facing that direction. That is a sign that this child may be having a nutritional problem affecting the development of the bones, which we most likely is rickets. We call it rickets in our language. Such children we treat. Can give them vitamin D and calcium supplements, and their bones can strengthen and they can even straighten, once we give them vitamin D and phosphates. Of course, there are those which may be having kidney problems, and they are unable to absorb calcium in their GIT. Again, this we can treat them with vitamin D3. In the rest of the patients who have lifestyle disorders, those who are drinking a lot, smoking a lot, I think we should advise them to stop smoking and drinking, because those are the risk factors which may eventually affect their development of bones. Now, in the elderly who have developed osteoporosis, again we give them drugs which tend to build their bones, give them calcium and vitamin D3, or they can be given an injection, which will help them to build their bones. Can have an injection once a month, or an injection once a year, and this can help them to strengthen their bones. Now, those with fractures, we have to do something. We do surgery on them. Okay, we do an operation. The operation we do is basically to fix those fractures. Once you have an osteoporotic fracture or pathological fracture, that fracture cannot heal until you have done an operation. We see it more in the hips, and those hip fractures we have to do replacement. We replace the hip with the prosthesis, which we call hemiarthroplasty, and then that will allow the patient to be mobile and pain-free. Then there is that one due to bone marrow disorders, a condition we call multiple myeloma. It's a disease, a cancer of the bone marrow. It tends to affect the bones, and they get osteoporotic, especially the spine. But of course, with the multiple myeloma, several bones will be involved. The spine, the ribs, the hips, the pelvis, and this may end up with a lot of fractures. That's more seen in the spine, where you get compression fractures. Again, with such, we do investigations, we do blood tests, we do bone marrow biopsy, and once we confirm that is multiple myeloma, then we start the patient on treatment, which is chemotherapy. So, ladies and gentlemen, if we have to build better bones, we have to be on the lookout for this disease. Here in Nakasero, I think we have the capacity, we have the physicians in place, we have other specialists, geriatric physicians who can manage this condition, And then we, the orthopedic surgeons, we are quite a number in this hospital, and we can handle all this condition in the children who present with bone deformities, in the elderly who present with pathological fractures, especially pathological fracture of the neck of the femur. The capacity is available. I'm glad to announce that Nakasero Hospital is expanding. You're going to get better theaters and bigger theaters, and every patient will have an opportunity to be operated from this hospital. So those few remarks, I'd like to thank you very much for having involved me on this very important day, that is the World Health Day on Osteoporosis, and to encourage the public, to come for checkup if they have bone pains, and if they have got children with deformities, bring them to us. We do the investigation and say whether it is metabolic disorder, and we handle it, things like rickets. And in the ladies, we would encourage them, to make sure after the age of 45, they should make sure they take calcium supplements and vitamin D to make sure their bones don't weaken. And then the elderly with fractures or with bone pain, they should always come for assessment. So thank you very much.